Hi everyone, my name is Melanie Vargas. I am a second-year medical student at the University of Florida College of Medicine. Thank you to SAGES for allowing me to speak at my first research conference. Oh, I'm supposed to click this, yes. Okay, these are our disclosures. All right, so IPOM is considered the gold standard for minimally invasive ventral hernia repair, but there have been concerns about long-term safety because of the meshes placed intraperitoneal. So there's been a movement towards using repair techniques that place the mesh more extraperitoneal. There are also newer approaches that allow for the repair of large ventral hernias using minimally invasive techniques, but there is limited data comparing different MIS approaches in small hernias. So our objective was to compare the trend and outcomes of minimally invasive approaches for small ventral hernias between IPOM, preperitoneal, and retromuscular. We did a retrospective cohort study. We included patients' elective minimally invasive ventral hernia repair that were 6 centimeters or less, and we excluded any peristomal or any patients that did not have any 30-day follow-up. And this was our breakdown, study breakdown, with the largest being IPOM, preperitoneal, and then retromuscular. Okay, so our results showed that there has been a decrease in the use of IPOM over the years. In 2013, it was used 90% of the time versus 2021 is less than 50%. And then the other repair techniques, retromuscular and preperitoneal, have increased over time. Okay, so there was a significant difference in the hernia baseline characteristics. For example, there were a lower proportion of incisional and recurrent hernias for the preperitoneal group. It was also the smallest defect width was found in the preperitoneal and largest in retromuscular. Over 85% of their preperitoneal and retromuscular were done robotically versus less than 50% for IPOM. And 14% of the retromuscular were done using the TAR technique. So in order to address for these unbalanced groups, outcomes were analyzed using the inverse probability of treatment weighting in order to create a synthetic unbiased group. Okay, so the adjusted analysis showed that there was no statistically significant difference in composite recurrence, 30-day reoperations, and 30-day complications between preperitoneal and IPOM, but there was a higher risk of composite recurrence and 30-day reoperation for retromuscular. Okay, so in conclusion, elective minimally invasive ventral hernias that are 6 centimeters or less, there's been a progressive increase in preperitoneal and retromuscular repairs over time, and they're mainly done robotically. There's been a high rate, 14% of TAR in the retromuscular group, and there's really been no difference in key outcomes between IPOM and preperitoneal versus retromuscular has shown higher rates of recurrence and reoperation. Thank you.